working for almost 11 years now, especially in US healthcare industry. And as far as my domain certifications or domain credentials are concerned, I am both PHM and PHIIS credentialed from the Academy of Healthcare Management Institute based out of United States. Over the 11 years, I have worked across major verticals of healthcare industry. So basically, we call like payer, provider, pharmacy. All these are the big players in the industry. So we call these are like major verticals. So I have the fortune of working across all these major verticals, and also I have worked across when I was working with all these major players, I had to work with some of these third party vendors who in turn work with these major players, right? So when we're working on any project or for any client, the client might not have 100% resources to fulfill his business needs. So he had to dependent on certain third party vendors who are specialized in such, who are basically specialized in certain type of work. We can talk about it further also, but yeah, I did work with different third party vendors. Just to give an example, I worked with the statement processing vendors, I worked with collection agencies, I worked with insurance reps. So all these comes under like different third party vendors. Okay, and the last but not the least, over the years I've been training for quite some time now. So over the years I have trained many aspirants, and I have introduced many aspirants to the US healthcare industry. Okay, so that's about me. Now let's dive into our course content. Okay, here it is. So basically, we had divided the overview or US healthcare overview for a 6 day course curriculum, and as you see on the slide, where just like any other course content, we start with the very basic fundamentals of health insurance, and we'll slowly move on and we'll slowly expand our geography, and we'll learn different aspects of the healthcare industry. So as you see on day 2, we will be touching upon different kind of benefits, enrollment and claims, and day 3 would be primarily talking about electronic transactions, and day 4 for HIPAA and other acts. Day 5 we have health information exchange, and day 6 is basically for any additional topics that would arrive as needed, and also for a recap that we are planning to do. So this is like a 6 day tight scheduled program, and as required or as situation demands, we can extend this curriculum. I mean after 6 days also, so it could be somewhere around like a week, a typical 1 week course curriculum, you can say. Okay, just a little bit about each day what we are planning to do, and what are the topics that we'll be covering. So on day 1, just like any other course, we'll start with the very core fundamentals of the industry. So we start with what is health insurance, so who would actually get it, and why would health insurance is required in general, right? And we will talk about the various components of health insurance and the different types of healthcare coverages we have in the market now. And just like anything, any any product, health insurance also comes in different types or different plans. So we have people talking about HMO, we have people talking about PPO plans, POS plans, whatnot. So we'll be learning about all this on a high level, and if anybody would like to deep dive, I will provide the resources so that they can refer further and learn more about any of these topics in general. So yeah, and we'll also touch upon the two key players of the industry, which is provider, and payer, and we'll talk about the differences. Okay, we'll start day two with benefits, enrollment, and claims. This is what we'll be planning to cover on day two. And yeah, just like any other topic, we will start with what is benefits, and we will then expand our knowledge to know more about these areas. So we'll start about what is benefit, and then what is an enrollment period, what is a claim. We talk about claim. Why is claim plays such a huge role. So we'll start with what is a claim, and we'll spend most of our day two talking primarily about claim processing. So we will see what is a claim process flow, and how does claims being submitted, and when a claim is being submitted, how does the claim gets adjudicated. So these are the different jargons, and no, nothing to worry about it. We'll be talking in detail about this claim processing as well, because we found the most of the employers are looking for somebody who understands the claim process and who can take off with that claim processing knowledge and work on multiple projects. So post our claims processing discussion, we will be talking about encounter submission and also compliance check. Why is compliance check so important, and what does people actually do as part of this compliance check? So that's going to be for the day two, and we'll move on to the day three. So as you see, day three will be all about electronic transactions, or one may call it as EDI transactions. So if you if you talk to somebody who works on healthcare domain, they will very well connect all these jargons, right? So if you get a chance, and if you have ever browsed through any job descriptions, or job roles and responsibility, just like on any job portals, you will see, okay, employers posting like experience in EDA transactions. So we will talk in detail about EDA. That is the reason, that is the primary reason why we have focused a whole day for just EDA transactions. So as you see, we have highlighted some of the main EDA transactions here. 837 for EDA claims, 835 for remittances, and then we'll talk about edits and validations. We'll talk about reports and different kind of acknowledgements. Yeah, so there are quite a number of EDA transactions that are exists in the system. So we'll try to cover as much as possible, and we'll try to explain as much as possible the various differences between all these electronic transactions. So that's going to be our primary topic for day three, and equally the equal important topic would be EDI 5010 transactions. So we'll also talk about EDI 5010 transactions as well. And yeah, the remainder of day three would be for ICD 10. So we park this for ICD 10 because again, as you have if you are making any inquiries about health insurance domain in general, you must have heard about ICD 10 implementation. Everybody is talking about ICD 10 implementation these days. So where we stand, and why does ICD 10 came into picture? So we'll talk in detail about ICD 10 and ICD 10 implementation, and what is the roadmap for ICD 10 implementation as well. So this is day three will be like a real job duties or roles and responsibilities kind of topic. Everybody should be aware of all these topics in order to prove their expertise in terms of the domain knowledge. So towards the end, we'll touch upon different codes, DRG codes, CPT codes, HICPIC codes, or HCPCS codes, one may call it as. So yeah, and then we'll review some documentation about uh, all these different types of codes as well. So that will be for day three. Day four will be mostly like one may feel it as listening to some stories, but these stories are not that funny ending stories, because any acts in health insurance domain are very stringent. All these acts or laws are very stringent in United States, and the main two acts, one or anybody would know if a person is working in healthcare domain, is HIPAA and COBRA. So as you see, I have just given the abbreviation of these acts. HIPAA stands for Health Insurance Portability and Accountability Act, and COBRA stands for Consolidate Omnibus Budget Reconciliation Act. So we'll talk in detail about HIPAA and COBRA and what happens if somebody don't comply with these laws or don't comply with these acts. That is the third point I have here: impact of the acts in health insurance industry. And with one act, how does the dynamic change in the industry? Also, we'll be discussing on day 4. So this is not like the total health insurance industry is not limited to these two acts, but these two acts are primarily being asked, and the expectation is to know more about these two acts as they are directly linked to our day in day out job activities. So that is the main reason we will primarily talk about these two acts on day 4, and then we'll also touch upon some other acts as well. So we'll try to explain how these acts impact the whole industry, how these acts impact all doctors, all hospitals, and all payers, all insurance companies, all pharmacies, right? All pharmacies like Walgreens, pharmacies like Walmart pharmacies, Rite Aid pharmacies, CVS pharmacy, and the labs. So we have way too many players in the health insurance industry here in the United States. So obviously, when we have like too many players that are primarily working out of different people and their health records, obviously government or the federal government and state governments, they will enforce certain rules, and they say everybody in this area needs to abide by these acts. So if somebody don't comply, and there will be like hefty penalties and hefty punishments will be awarded to those that don't comply. So that's the reason we primarily park day 4 for discussing in detail about various acts that are out there in the real world. So that's a wrap on day 4. And day 5, yes, health information exchanges. So this is a new content that we're actually covering for the last 1.5 years, because this is the trend that is happening in the real world here in United States for anybody who are planning to buy health insurance from the government, right? So this is nothing but if you're a little bit familiar about the domain or the environment here in health health industry in United States, so you might very well have heard about Obamacare, and Obamacare mandates every citizen to have health insurance. If not, some kind of penalties they have to pay for not having health insurance. As though it sounds a little bit not practical or a little bit not realistic, but that's how that works actually. So Affordable Care Act, that's the original name of the act, but mostly people will recognize this as Obamacare. So on day 5, we'll actually talk about what is Affordable Care Act, and what are these various government reforms and why do they do that. And yeah, so we'll be starting day 5 with Affordable Care Act or Obamacare, and also many other government reforms that are in place today. And we'll move on day 5. We'll talk about electronic medical records. What is electronic medical records, and who are the big players that are out there in the industry and dealing with the electronic medical records? So there are huge players. Like these players are nothing but software vendors. So they provide software that will actually work for the whole hospital for their day in day out activities. So this will be an interesting topic, and this mostly will be covering the new trends in terms of dealing with electronic medical records. So day 5 will be talking about electronic medical records and the big players in the industry, and also will specifically talk about healthcare exchanges. How do these healthcare exchanges work, and how are they comprised of? How do people buy their health insurance from these healthcare exchanges? And yeah, to get familiarized with the terminology and the deliverables, we'll try to review some kind of documentation that will actually happens in the real world, and also a few sample artifacts. So that's about day 5, primarily health information exchange and different kind of trends and techniques that are actually working in today's world. And after successful day 5, the last day as far as our content is concerned is day 6. And day 6 and day 7, as I said in the initial, day 6 and day 7 are basically for parking lot items. If as the days goes on, there will be a need for us to become up to date as far as the current technologies or current trends are concerned. So day 6, and if required day 7, we will be primarily talking about all the parking lot items or any new or ad hoc topics that comes as far as the jobs and responsibilities are concerned. So that is the reason we have it here. So we will talk, I mean, we must have discussed a whole lot in the first 5 days, and on day 6 this is to recap any additional topic. So you, as an audience, I will be receiving the feedback on a daily basis, and as required I'll be repeating some of the topics as well the next day. If somebody is not clear or somebody wants me to just to touch upon and shed some light, that's what we'll be doing as well. And yeah, if any additional topic need to be discussed, and I'll be doing the research, and we will certainly be talking about the new topics on day 6, and also a recap. So that's the reason we have here. We'll be discussing additional topics as per the current job market demand. So that concludes our demo. And yeah, so if you have any questions, Gautami, you can contact Gautami at softtechteam.com. She is the training coordinator, and you can let her know your feedback, and we look forward to hear from you. And we hope you will join us in the training program. Wish you good luck, irrespective of your decision to join us. We would like to wish you good luck in your job search and all the future endeavors. Thank you.